everyone. I am Rosandole Garcia, a nurse student at Pan Pacific University. Today I'll be assessing the abdomen and extremities of the patient. Okay, good morning sir. I am Rosandole Garcia, a nurse student for today. Today I'll be assessing your abdomen and your extremities. So we do this to ensure that there are no abnormalities and that everything is normal. Please cooperate by paying attention to what I am saying, okay? So, can you please state your name and age, sir?
Christian Agustin.
Okay, so now I'm going to wash my hands, but for now I'm going to use a alcohol to sanitize my hand and observe the appropriate infections control procedures. We sanitize our hands. Now I'm going also to sanitize the hands of my patient to prevent spreading of microorganisms. After that, now I am going to close the open doors, windows, and curtains to provide privacy and to minimize the embarrassment. Okay, so now I am going to assess the abdomen of the patient. Okay, so first is to inspect the abdomen for skin integrity. Okay, sir, can you lay down? Okay, so can I move up your shirt? Okay, so as I'm inspecting, the abdomen is paler than the general skin and there is no signs of lesions or scars. Okay, next is to inspect the abdomen for contour and symmetry. Okay, so as I'm inspecting, the abdomen is symmetry and there is no signs of organ enlargement. Okay, so now I'm going to observe the abdominal movement associated with the respirations, the perithalsis, or the aortic pulsations. Okay, sir, can you breathe in? Breathe out? Breathe in, breathe out. Okay, so the abdominal movements is normal, same as the peristalsis, respirations, and the aortic pulsations. Okay, so next is to observe the vascular pattern. Okay, sir, can you breathe in again? Breathe out, breathe in, breathe out. Okay, so as I observe, there is no visible vascular pattern. Okay, so next is to auscultate the abdomen. Okay, so now I am going to use the diaphragm of the stethoscope. Okay, so what we are trying to assess here is for the vowel sounds and the peripheral friction. Okay, so everything's normal. Okay, so now I am going to percuss the abdomen of the patient. First, we're going to percuss the several areas of the four quadrants to determine the tympanic and dullness. So, I am going to use my hands to percuss and tap only the finger. Okay, so as I percuss it, there is no signs of abnormal dullness and only thing I heard is the tympanic sound. Okay, so now I am going to palpate the abdomen. I am going to use my index finger and the middle finger to palpate the four quadrants. Okay, so as I'm palpating, there is no tenderness and it is soft. Okay, now we're going to palpate deeply the 4 quadrants. Okay, so there were no palpatable masses detected. Everything is normal. Okay, so now I'm going to palpate the umbilicus of my patient. Okay, do you feel anything, sir? Okay, good. Okay, so everything is normal. There are no swelling and tenderness. Okay, so now I am going to palpate the liver of the patient. Okay, so everything is normal, it is smooth, and there's no signs of tenderness. Now let's proceed in palpating the gallbladder. Okay, it is also normal and there is no signs of tenderness and it's good. Okay, so now I'm going to percuss all the areas of the abdomen using this systematic process. The 4 quadrants, right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Okay, so everything's good. Okay, so we're done in assessing the abdomen. Now we're going to assess the lower and the upper extremities of the patient. Okay, sir, let me arrange your clothes. And can you please stand up, sir? Okay, that's the musculoskeletal assessment. Now, first, I am going to inspect the extremities for any lesions, redness, and swelling. Okay, so as I'm inspecting, there is no signs of lesions, redness, and swelling. Okay, sir, can you do this? Do you feel anything? Okay, good. Now, can you please move upward your hands and close your eyes and hold for 10 seconds. Okay, good. Now, I am going to assess the sensation for the temperature, pain, and touch. Okay, first is the temperature. Okay, everything's normal. And now I'm going to assess the muscle strength of the patient. Can you squeeze my hands as far as you can? Okay, good. Now I'm gonna let you push me and I am going to do the same. Okay, good. Everything is good. Okay, so now I am going to palpate at the radial pulse and report at the rate and quality. Okay, so now I'm going to use my index finger and the middle finger because it is significant from others. Okay, so it is bilateral. They are 2+, and they are both equal. Okay, so now I'm going to assess for the nails and capillary refill. So I'm going to check now the capillary refill. I'm gonna press the nail bed and see how fast it comes back in its less than 2 seconds. Then we're gonna check. Okay, so we're just gonna look at the range of the motion of the fingers. Can you do this, sir? Okay, so look at the hands for joints. Okay, so everything is normal and that is good. Okay, so lastly, we're going to assess the lower extremities, thus the musculoskeletal assessment. So first of all, we're gonna do is to inspect the color from the legs to the toes, making sure it's nice and pink. Okay, so as I inspecting, it is a little bit of tan line and the skin is brown. Now assess for sensations, the temperature, pain, and touch. Okay, so the temperature is warm. Do you feel anything, sir?
No.
Okay, so now I'm going to palpate the pulses and reports the rate and quality. So, palpate the popliteal pulses, which are behind the knee. And those are about 2+. They are bilaterally. And now palpate the feet. We're gonna feel on the posterior tibial. It is 2+ and it is really good. And also palpate the dorsalis pedis, which is on the top of the foot. Okay, so as I palpating, everything seems good. Now